So I think, Corey Simon here at this talk did a really nice job outlining some of these, the idea of precision medicine, outlining this idea that if we can figure out more consistently what this patient coming in the clinic looks like and how we can match this to a treatment, to an intervention, that's precision medicine. And so the idea with this, and the example I used in my talk this morning is this idea is if we can say, okay, for example, neuropathic pain. One of the primary drivers of neuropathic pain we know right now is neuroinflammatory mediators along the nervous pathway, especially with chronic neuropathic pain. We also know that manual therapy, specifically nerve glides and some of that stuff, does well changing neuropathic neuroimmune modulators along that nerve pathway. We also know that manual therapy influences neuropathic pain. But those dots haven't been connected for us to say, this person has increased neuroimmune modulators along this nerve. We're modulating these with our manual therapy techniques, and that mediates, from an analysis, from a stat standpoint, that mediates the clinical standpoint, the clinical outcome. That's why they get better.